We'll now discuss the application of acupuncture for plantar fasciitis. We're going to be working a lot with the bottom of the foot here. So the first point I'm going to show you is at the attachment of the plantar fascia up here to the ball of the foot. And this point is located between the second and the third metatarsals. And if you ask your client to plantar flex the foot, there's a depression formed, and that's exactly what you're aiming for. So go ahead and relax your foot. And you want to do a perpendicular insertion about 1 inch to 1.5 inches. And just go nice and slow. Again, this is the bottom of the foot. People don't love this. All right, so now we have our needle in about 1 inch, and it's directly into this depression. So now we're right into where that fascia attaches up here to the ball of the foot. Now we'll go down here to the origin of the fascia at the heel. So when we went over the anatomy, we talked a lot about the anatomy of the heel and how the heel has this multilobular fat pad. And then underneath that is where we have the attachment of the plantar fascia. And then underneath that, we have the calcaneus or the heel bone. So when we're going here to the sides of the foot, we have a really nice place of access here on the medial side of the heel in order to slide some needles directly underneath this fat pad and in between the fat pad and the plantar fascia. And this is going to dispel a lot of stagnation that can show up here in the heel and really relieve a lot of pain. I like to do 2 needles here. And the first, I just find the entirety of this fat pad of the heel. And we're going to go along the medial side. So I find this anterior border and I just go back about 1/4 inch. And you'll find on the side of the foot, you can palpate and you'll feel where the top of that fat pad is. So you'll insert your needle and you'll just aim directly under here towards the heel. If your needle touches calcaneus, if your needle touches the bone, you're a little bit too much towards the heel. So you take out your needle, put it in the sharps container, and you can reinsert and just make sure that you're a little bit closer to the bottom of the foot. And we'll use a second one here. This time we'll just go a little bit posterior. And this is just directly into this space. So these 2 needles here are placed appropriately. They're between this fat pad and then between the plantar fascia, and they're not touching the calcaneus. So now we have a nice way to really dispel the stagnation locally in this area. The final local needle, this is an extraordinary point. So these points here are on the kidney meridian. This is an extraordinary point. It's not on any particular acupuncture meridian, but it's a nice empirical point, and it also helps to release this attachment of the plantar fascia at the calcaneus. So you'll find this anterior portion of the heel, and there's a nice depression right here, and you're just aiming towards the posterior portion of the heel. So you use a transverse oblique insertion about 30 degrees, and then you'll just stop when your needle, the tip of the needle will rest in that plantar fascia. You'll know it does because it just starts to feel really tight on the needle. You're not touching the bone, and you're just right there in that plantar fascia. All of these together are really wonderful local points to help dispel that stagnation of qi and blood that arise as a result of the plantar fasciitis. Because plantar fasciitis also has this calf involvement, like we talked about with the anatomy, how the attachment of the calf goes down here to the calcaneus, and also the attachment of the plantar fascia also has the calcaneus. I also like to treat the calf. So I would consider this a distal application, and this is along the urinary bladder channel. So you're just going to go up the calf muscle and find directly in between the 2 heads of the gastrocnemius muscle. And there's a depression here, and you just place a needle directly here into this depression. And this is about 1 inch to 1.25 inch insertion. And you're not trying to go all the way down through the soleus. You're not trying to touch the tibia. You're just trying to find that nice point of qi that really helps to release this entire area. This is also a nice one to pair with a Dui-Yao needle. And I like to go a couple of inches distal here. So you also find another depression. So you just run your finger along and your finger will fall into a separate depression. This is about 3 inches distal to that first needle, still on the urinary bladder channel. And this is, again, the same principle. You're not penetrating through the soleus. We had a little fasciculation here, which is good. And then now you're just placing that needle directly into that muscle. And this is a really nice way to help treat the calf involvement when it comes to plantar fasciitis. The final distal area that I will show you for plantar fasciitis is on the heel of the hand. And again, we're using that idea of imaging. So we're using the heel of the hand to image the heel of the foot. And we're going to be working with the heart channel on the heel, the palm of the hand. So you can find the palm of the hand directly about an inch, half inch distal from the crease of the wrist, and this is on the heart channel, and this is going right into basically that meat of the palm. And insert your needle, just go right into that flesh, about half of an inch. And this is, again, sending that strong chi and blood flow signal to the heel by working with the heel of the hand, the palm of the hand. Still working with the heart channel here, you can start to move even more distal up the heart channel, and this would be in the space between the fourth and the fifth metacarpal. And if my model here were to make a fist, then this would be where either the tip of the ring or the pinky finger landed, and it's just directly here between the fourth and the fifth metacarpal. And this is working on its analogous structure to the length of the plantar fascia. So we're using this as an analog to the heel and then the sole of the foot. And this is why we're choosing the palmar side of the hand to really help treat with the heel.